Dhanvantari Namaha. Namaste. A very warm welcome to this wonderful session. I am Dr. Arun Kumar and I am honored to be your host today for this enlightening and webinar on Ayurveda practice, beautifully organized by Team Ayuryana with humility and respect. I bow down to the revered gurus and esteemed guests present here today. It is my honor to welcome our distinguished guest, the organizers, and our enthusiastic audience to today's session. I would like to introduce Ayuryana. Ayuryana is a holistic platform that brings together diverse activities for fostering a unique blend of learning, exploration, and community engagement. Its initiatives include offline and online classes and workshops, informative articles and health tips, health focused camps and events, recreational activities, and ex- excursions for students, individuals with the physical challenges, seniors, and general publics. Sustainable tourism programs such as ecotourism and agritourism. Ayuryana proudly blend tradition with innovation, events, and activities. In incorporate traditional practice, local cuisine, and rural games. It is inspired by the timelines practices of Ayurveda, threads moral and cultural traditional values into every experience, creating a rich tapestry and heritage and wellness. There is an exciting announcement from Ayuryana. I request Dr. Radha ma'am to share some words.
Om Dhanvantri Namaha. Namaste all. I heartily welcome you all to our webinar series on Ayurveda practice. We are conducting 2 days residential workshop on Ayurveda practice on 24th and 25th May 2025 at Sagar. So this is the second workshop we are hosting. All UGs, PGs and even practitioners can join the session. The workshop includes 8 sessions where our eminent speakers are going to share their decades of experience, guide us to apply Samhita into practice, discussion on doshas, lifestyle disorders, treatment with and without Panchakarma, Ayurveda cardiology, emergency care in Ayurveda, herbal visit to study the drugs, and many more interesting activities and sessions are awaiting for you. So, limited seats we take. Register soon and join us for the enlightening journey. Thank you.
Thank you, ma'am. Now I request Dr. Ishwari to introduce about webinar and speaker.
Thank you, Dr. Arun. Om Dhanvantari Namaha. Webinar series on Ayurveda practice is a free webinar series planned to conduct on every Saturday for an hour. The motto is to empower the Ayurveda fraternity to excel in clinical practice and sustainability through the innovative approaches in Ayurveda entrepreneurship. It gives immense pleasure to introduce a truly inspiring personality in the field of Ayurveda, our esteemed guest speaker, Dr. Spoorthy S. Naik, hailing from the Serain district of Dakshina Kannada. Ma'am laid her academic foundation at the renowned STM Institute in Ujjain. She pursued her UG from the A.L.N. Rao Memorial Ayurvedic Medical College, Koppa, where her dedication and academic excellence earned her the sixth rank under RGUHS. With a strong interest in the cardiovascular domain, ma'am furthered her expertise by specializing in Ayurveda cardiology as a 2 year research scholar at the prestigious Sri Ranga Ayurveda Chikitsa Mandira in Mysore, where she currently serves as a Ayurveda heart care consultant. Her academic journey is adorned with remarkable achievements. She has presented 3 research papers at reputed institutions including Munyal Ayurveda College and Kottakkal Ayurveda College, and she also secured first place in national essay competition conducted by Vaidyaratnam Ayurveda College, Thrissur. Adding another feather to her cap, she is soon to be a published author with her book titled Understanding Cardiology in Ayurveda, set to release shortly. Her contributions have not only been academic, she is also a much sought after guest speaker, having shared her insights at various platforms dedicated to Ayurveda. Currently residing in Hassan, ma'am is multilingual expert, fluent in Telugu, Kannada, Hindi, English, and Telugu. A true reflection of her culture, connectivity, and communication skills. Ma'am, please join us and we look forward to hearing your invaluable insights today. A warm welcome to you, ma'am. Please share and subscribe to Ayuryana channel and drop your doubts in the comment box and ma'am will answer at the last. The stage is yours, ma'am.
Correct. I'm audible, right? It's clear. I can start.
Yes, ma'am.
Shri Gurubhyo Namaha. Harihi Om. Shri Dhanvantariye Namaha. So today's topic, through the lens of Ayuryana, I'll be speaking about Ayurveda and cardiology. So the pun intended is the heart of the matter. So basically, the first questions that I get as a healthcare consultant from the clinicians, from students, and from patients alike is, do you really treat hridroga? Do you really treat heart diseases? Or does Ayurveda have anything to do with the heart? So sometimes I do feel very sad when students of Ayurveda ask me this. Clinicians do not go ahead with medicating people with heart diseases. So the
Excuse
first
me, ma'am.
question, yes,
Voice is vibrating. I think you should hold the mic and speak.
uh, is this better?
Huh.
This is better.
Yeah.
Okay.
Now it is okay.
So the first question that I usually tackle is, Ayurveda capable of treating Hridroga? See, basically, Ayurveda is capable of a lot more than what we give credit to. So, Hridroga is a very small part of it which can be easily treated and managed in Ayurveda. So, how do I say this? And how should we understand heart care and Ayurveda is what I will be speaking about today. And the next question that I would like to answer in the first half itself is, why is this necessary? So when we speak of Ayurveda, we speak of Ashtanga Ayurveda, where cardiology or disease-specific things are not mentioned. We go by Kaya, Bala, Graha, Urdhva, etc. But we do not treat liver diseases. We do not just treat heart diseases. Why is that so? So the one point that I'd like to mention is because we see the Sharira as a whole, as well as cardiology is an innate part of Ayurveda. It is not something different. It is not something out of the syllabus, basically. So, and why is this necessary? See, learning about different diseases which we see contemporarily. So, recently, we have seen an uphill increase of non-communicable diseases. Sorry. So, in previous decades, we saw communicable diseases, but now this is the decade of non-communicable diseases, among which heart diseases are the number one killers or silent killers even. So this is why we do need to understand cardiology, the aspects of Hridaya, Hridroga in Ayurveda. So what will we basically be seeing in this section? The first is the Ayurvedic understanding of Hridaya and Hridroga. When I say the Ayurvedic understanding, please make sure to listen very carefully. Ayurvedic understanding is very different from the contemporary understanding of the heart and diseases of the heart. Hridaya and Hridroga, as from the lens of Ayurveda, is what we will be seeing. The next is about the Samprapti, the Roga Nirnaya, and the Chikitsa types of the Hridaya and Hridroga. And last but not the least, understanding contemporary knowledge and Ayurveda context. What do I mean when I say understanding contemporary knowledge? Basically, when a patient comes to you, the first thing they say or they bring is the report. It may be blood reports, it may be the ECG, it may be the echocardiography report, or simply it may be to ask you to check their blood pressure using a sphygmomanometer, now CNRD. So when I say contemporary knowledge, this is what I'm referring to. Can we understand all this in the terms of dosa, dhatu, and mala? I say yes, and we'll see how we do that in the next slide. So let us begin with understanding whether the Hridaya and the heart are one and the same. So, why do I ask this question? Before we go into the depth of the topic, let us see how old our knowledge base is. See, the concept of Hridaya is mentioned way back in the Vedas itself. So, some of the references are just mentioned, including Atharva Veda, the different Puranas that we see. Devi Bhagavata Purana, it has the mention of Hridaya. Shiva Purana has it. Chandogya Upanishad has it. From Natya Shastra, even Sangeeta Shastra, Yoga Vasishtha, Halayudha Kosha, Jyotish Shastra has a lot of mentioning of the Hridaya. And in a very different way, even Shilpa Shastra talks about the Hridaya. Slightly different from the Hridaya in our Sharira, but of course, it also talks about the concept of Hridaya. And obviously, when we come to Ayurveda, our Samhitas, Brihatrayis, they are a treasure trove of information about Hridaya, Hridroga, the Nidana, the Lakshanas, the types, and everything that has to do with it. And following the Brihatrayis, we have the Laghutrayis also. You get ample references of Hridaya, Hridroga. Then comes the other Samhitas, Vangatona, Dhanvantari, then Vela Samhita, even all the Rasa Sara Sangraha, Rasa Ratna Samuchaya, Bhava Prakasha, and the different nigantus that we have, which are available in different pieces, even then, they do have the references of Hridaya. But why do I say Hridaya and heart are not the same? See, the concept of a heart, the anatomical and physiological concepts or the physiological aspects of the heart in the contemporary science, it came into vogue or it came into a more descriptive type of knowledge only in the early 17th century when William Harvey discovered the circulation of blood. The other point that I'd like to make here to sustain my point that Hridaya and heart are not the same is because Ayurveda gives a lot of different attributes to Hridaya. It is not just a muscular organ. It is not just a pumping organ. It is not just an organ which helps with contraction, relaxation, which actually circulates the blood. Ayurveda sees Hridaya in a very different light along with all these. I'm not saying these events mentioned, but along with all these, the special attributes that we see include Hridayam is the Chetana Adhisthanam. Chetana is Manas. So Mano Adhisthanam is Hridaya. So when we speak about the stress, the anxiety, the depression, and all the other manovyadhis that are affecting the general population today, and we also hear people say, "Oh my God, I have a lot of stress, so my heart might have been a weak." In layman terms, this is where we take it. This is where we take where the concept of manas and hridaya being related to stems from. This is a very important aspect of the hridaya and the role of manas. The next is the concept of Sroto Mula. Hridaya is the Sroto Mula of Rasavaha Srotas and Pranavaha Srotas. Because Hridaya is one among the Dasa Pranayapanas. It is one of the most vital spots in the body where prana itself resides. It obviously will be the Pranavaha Sroto Mula. Along with that, Rasavaha too. Then the concept of Utpatti, when the concept of Utpatti of Hridaya comes, there is a common misunderstanding where students are taught that Hridaya Utpatti happens in the fourth month of Garbhavastha. The particular word used is Abhivyakti, not Utpatti. Every word that the Samhitas mention has a particular importance and meaning. When we say Abhivyakti means to be showcased, or Abhivyakti is the concept where something becomes open or becomes visible. That is Abhivyakti. So it is not just the Utpatti. So when we speak of Abhivyakti, the Abhivyakti of heart happens in the fourth month as per Acharya Sushruta. The other thing with the special attribute about Hridaya is the concept of Marma. Again, it is the Ojosthana, it is the Pranasthana, it is the Dasa Pranayatana, it is one among it, it is also one among the most important three marmas of the body. Then comes the concept of Tridosha and Saptadhatu. Generally, when we talk about the dosas and dhatus, we usually take it up with Udana Vata, Prana Vata, Vyana Vata, which are apparently in the sthana of Hridaya. Some things that I'm leaving out of the presentation is that the simple sense of the sthana of Hridaya uh, and the other detailed Utpatti of it, because we do get it and we some hetas, and this session is more or less uh, the objective of this session is more or less to talk about the clinical part of understanding Hridaya and Hridroga as per Ayurveda. So when it comes to the Tridosas, even though Prana, Udana, Vyana are easily taken to be associated with Hridaya, Apana and Samanavata are equally important, along with not only Avalambaka Patha, but all the other Pathas, Panchapatta. When we say a particular sthana is one dosa or dhatu dominant, it doesn't mean that the other dhatus or dosa are not present. So this is why I use the term sapta dhatu and tridosa when referring to Hridaya. As an avayava, it has all of these. So moving on to the next slide, let us talk about Hridroga, the actual core of the topic. So what is Hridroga? What is a heart disease? What is a cardiovascular disease? When we speak of these three terms, there are superstitions, but there are subtle differences between all these three. When we talk about Hridroga, the word itself means the roga of the hrit or the heart. Very simple, isn't it? But does it mean only the avayava is involved in this? No. The Ayurvedic way of looking at the disease does not only stop at looking at the organ. It looks at it at different aspects of it. When we take Hridroga, we talk about the Vidosas, we talk about the Saptadhatus, we talk about the Malas, we talk about the Srotas, we talk about the Marmastham, heart being the Marmasthana, we talk about all these things along with the Manas. And all these things have to be taken hand in hand when we speak about Hridroga. But what is it that cardiovascular diseases, heart diseases, and Hridroga, what are these? How are these different? When we say cardiovascular diseases in the contemporary times, cardiovascular refers to the diseases of the entire circulatory system, so of which heart is a part. So when we specifically say heart diseases, it means the diseases of the heart alone, which is a part of the cardiovascular diseases. The diseases of the blood vessels are referred as vascular diseases. For today's discussion, we will not be going into depth of those. So the actual question being heart disease and Hridroga being the same, no, these are not the same. Hridroga is not equivalent to heart disease. So next time when a patient comes with a report stating maybe cardiomyopathy, coronary artery diseases, or ischemic heart disease, or rheumatic heart disease, or valvular issues, do not directly say that that is Hridroga. Do not write it as Hridroga. It is a disease of the heart, yes, but is it Hridroga is the question. Why do I say this? In my last 6 to 7 years of experience, I have seen that Hridroga is needed always see what it appears to be. When a patient comes to us, they usually say either they have chest pain, they have breathlessness, they have headache or recurrent giddiness. These are general symptoms along with edema, either the swelling of the feet, so and so. But why do I say this? That these are not Hridroga, these may not be Hridroga itself, because Hridaya related lakshanas are seen in many vyadhis in Ayurveda. For example, Ujvara, please go and see. There are lakshanas related to Hridaya in Jvara, in Gulma, especially Vata to Gulma. Vata to Gulma, the pain which you see in cases of Vata to Gulma mimics Hristola. It is that you feel it is one and the same, but they're completely different. In Arshas, yes, even in Arshas, Hridaya related symptoms are mentioned. Pandu, we'll see in Pittaja Pandu, there's a case that I've dealt with. Vata Vyadhi, obviously, simple cases of Amashayagata Vata. Even in Amashayagata Vata, the symptoms mimic angina or chest pain. You have the same symptoms. People will start sweating, people have pain on the left side of your heart, on the left side of the body, they have shoulder pain, all the classical symptoms of a heart attack or the heart problem, but no, that is not basically the Hridroga in itself. This is why I say Hridroga needs to be uh, differentially diagnosed along with other vyadhis and other lakshanas in itself. So we've spoken of cardiovascular diseases. Some of the examples that you will clinically see, the patients come with hypertensive diseases, very commonly seen unfortunately, even in young people, they come with fluctuating blood pressure, high, sometimes low, hypotensive cases, hypertensive cases. Then we have diseases of the coronary artery. One, almost every person that you meet will know somebody who's got a stenting done, who's got a bypass done, unfortunately. So we have pulmonary heart diseases, we have rheumatic heart diseases, and of course the congenital ones, we have inflammatory heart diseases, and so on. So going to the next slide. Okay, this is something that everybody expects to understand, everybody expects to know. But when I talk about Hridroga Nidana, I usually do not I will not go into detail about the general Vata Janadana, Pitta Janadana, Kapha Janadana. I handpicked a few symptoms, a few Nidanas here. The special ones, these are some things that I have seen in my clinical practice. So the first and foremost is Atyambupana. So you ask anybody, there is at least 1 in 5 people, they will be drinking excess water. So yes, people have become sicker to all this, drinking lots of water without thirst. Drinking water early in the morning on empty stomach, and it goes up to a liter, 2 liters of water. So Atyamupana is one of the leading nidanas of Hridaya-related lakshanas of Hridroga itself. So if I can say the contemporary uh, diseases that are caused because of this, the first thing that comes to my mind is hypertensive issues. You take any history of any person who has hypertensive issues, the first thing you've got to rule out is Atyambupana. The next is this is unfortunately again a rising trend among the young people, Ati or Akala Vyayama. See, Vyayama is a very good thing. Do you need Vyayama? Obviously you do. But Ati Vyayama and Akala Vyayama. Unfortunately, today we have 24/7 gyms. God knows why, but yes, we have gyms. People going to gyms at 8 at night, 10 at night, 12 at night. I've had a patient who said he used to go to gym at after 11 because it's all prasant, there's nobody there and all. That is a problem. Ati Vyayama, again, yes, do you need to be fit? Very true. You need to be fit. Obviously, you need to be fit, but Ati Vyayama is not the way. We've seen some of the celebrities passing away due to this Ati Vyayama and Akala Vyayama. Vyayama soon after food, yeah, Ati Vyayama in empty stomach excessively, irrespective of the seasons, irrespective of the issues that they have, all of this needs to be taken care of. When you take the history, all of these need to be noted. The next is Manovikriti. As you know, unfortunately, the youngsters, they're falling victim to all of these. Anxiety due to work, anxiety. Young children. One of my youngest patients was a 19-year-old boy who had a severe anxiety, who had, because people in schools and colleges, they expect you to score. There is no concept of rest or relaxation. It's either excessive relaxation or it is very little. So they do not relax, especially mentally. If you're not doing anything physically, you'll be scrolling to your phone or laptop. So that leads to a host of manovikriti. And because manas is the sthana, Hridaya is the sthana of manas, manovikriti will lead to Hridaya-related lakshanas and in the long run, it leads to Hridroga. The next thing is Ahara Anachara. Why Anachara? See, children, very young children, when they're brought to us, the first questions that parents need to ask, and they do ask, is whether our medicines or any medicines are safe for children. Is that a good thing? Yes. But the same parents will take them outside to eat junk food. I have seen 2-year-olds, 3-year-olds, 5-year-olds being given very Manchurians, being given fried items, being given all these masal puri and all that. So that is anachara. Again, eating without hunger, eating after skipping your meal and eating when you're not supposed to. Let's say people who work in shift duties, they tend to eat very late at night or very early in the morning. So this is ahara anachara. Then next one is ati ausadha sevana. Being a doctor, sometimes I have to force my patients to actually stop their medicine. So people tend to feel that if they're taking medicines, only then they're supposed to be healthy. Ayurveda says Swasthasya Swasthya Rakshanam is also our kartavya. So when I say Ati Aushadha Sevana should not be done, it needs to be taken care of by us doctors also. And lastly, unfortunately, I see a lot of patients who come from improper shodhana. Either the patients have not followed it or either the doctors have not given proper care during the Panchakarma. Because this one question is raised very frequently. Can Panchakarma be done in Hridroga patients? Yes, if they fit the standards of Panchakarma, irrespective of their report, if they fit the standards of Panchakarma as given in the Samhitas, yes, they can undergo Shodhana. I've gotten many patients done. I've gotten a lot of patients who have undergone Panchakarma, even when their ejection fraction was very low or other complications. It is absolutely necessary, it is absolutely safe. So these are the special Hebrew Nidanas that I would like to say. The rest of this, yes, we all already know what are the Vatajanadanas, Pittajanadanas, and Sapajanadanas. All right. So the heart of today's matter will be understanding how Hebrew actually operates. So the Samprapti. Basically, when we take the Samprapti, we will have to look into the dosas and rules. We'll have to look into the role of other dhatus, the frutas, manas, and all of that. But here I'd like to first take up the sloka, the Samprapti as given by Acharya Sushruta. दूषयित्वा रसं दोषा द्विगुणा हृदयं गताः कुर्वन्ति हृदये बाधां हृद्रोगं तं प्रपद्यते. So what is the main precursor to Hridroga? Viguna dosas, as in any other vyati, it is Viguna dosas. But where are these dosas? All these Viguna dosas, when they cause the dishti of rasa also, or they go sit in the rasa dhatu, and this rasa dhatu causing carrying the dishta dosas along with being dusita, this goes into the heart, circulates through it, then it causes Hridroga. So basically, when we talk of this Samprapti, is it that only Rasadhatu is involved? Is it only all the dosas that are involved? And is it only the Avayava which has actually been afflicted? The first answer would be it is not the Rasadhatu alone. However, Rasadhatu Dusana has to occur if Hridroga has to occur. So basically, when we talk about Rasadrushti, diseases due to Rasadrushti, such as Swara, the basic Rasadrushti, Vyadhi, Swara, Pandu, Raktapitta, Gulma, Prameha, all of this, remember, all of these diseases will become differential diagnosis when you see a case of Hridroga. If any Rasavikriti Janya Vyadhi has to be taken care of, Kushtha even. First, these have to be taken care of. You have to look at the Samprapti very clearly to see if the Samprapti is leading towards the Hridaya alone or has all of this occurred. Any of this has occurred and then Hridaya is being afflicted. Coming to the dosas, even though when we speak of Hridaya, the main things that we see clinically is Udana Vikriti, which is Urahasthanam Udanasya, again Hridaya is in the Uras. So Udana Vikriti, especially in cases of Ati Vakpravritti, and any Vikriti of the Udanavata, any Vikriti of the Pranavata, and any Vikriti of the Jnanavata. These three are the first in line to cause Hridroga, or if a disease, if a problem occurs to the Hridaya, these three will be afflicted. It is both ways. So when we talk about dosa, it can be all the dosas, it can be few, it can be anubandha, or it can be single dosa also. Then When they say Hridaya Badham, is it only in the Avayava? No, even though the Hridaya itself is the main seat of affliction, the Lakshanas can occur anywhere in the body. This is the Hridaya is the main seat, but affliction can occur anywhere in the body. So when, again, floaters. The floaters that we actually look at is the Rakavaha floaters, Raktavaha floaters too, Pranavaha floaters, yes. These three either are afflicted after the Hridaya is afflicted, or the affliction of these three causes the problem in the Hridaya. However, all the other Manovaha floaters has to be taken into account. All the other floaters is also unneeded. When we say about the Manas, we've spoken recently, and yes, Manas, the role of Manas, I cannot stress enough, it can cause anything. It can make your heart happy, it can make your heart sad, it can make your heart really relaxed, it can make your heart very congested. So, role of Manas is again, it is an entire presentation in itself. So when we speak about Hridaya, Hridroga, heart and Hridaya being different, one of the reasons is that the Hridroga is classified into five different types according to Ayurveda, whereas in the heart diseases, in case of heart diseases, they are very different. The classification, the basis of classification is very different. Here, when we say Vataja Hridroga, Pittaja Hridroga, or Kaphaja Hridroga, we classify based on what dosa is afflicted or what dosa is causing the affliction. Both these ways. But whereas in the contemporary sciences, the classification is a little different. So it is based on ICD level. The others. The other point is primitive Hridroga. When I spoke about Pandu and Rasavikriti, Rasavikriti, Pandu, and primitive Hridroga have an innate coordination between them. So again, this is for the other time. Again, when we have to understand the sum property, we have to understand the different Kriya Kalas. Why? Because if we understand Kriya Kala, only then can we treat Hridroga or related Lakshanas. See, the Sanshaya I take it as the initial stages where the dosa Vikriti has occurred. The dosas, the Dushta dosas are sitting in Rasa, waiting for their time. Prakopa is again when you supplement all these Dushta dosas with further afflicting nidanas, which can either increase the dusana of Rasa or the dosas in the Rasa itself, and then you see the Prakopa Lakshanas. Once this occurs, and if the nidanas are consistent, the nidanas are continuous, the nidanas are always there, there has been no samana or sodhana or these dosas after dusana, they are not reduced at all, they start moving towards different pathways. Prasara is where you see the different lakshanas occurring in different sampraptis and in different pathways. Usually patients come at the stage of prasara or prakopa. If in case of prasara, you have to look out where has it gone to, which places is it moving towards, which sthana is it more, has it more, which sthana towards which it has more tendency. Then it comes to sthana samsaya. Sthana samsaya is when you know the dosas have taken a tendency towards a particular place, a particular avayava, and they've taken abode. They've gone sat there, they're causing havoc in the particular area. And here, Sthana Samsaya refers to these Dusita dosas being going and sitting in the heart itself. So the next Vyakta and Bheda. In Vyakta Sthana, of course, you see all the Lakshanas of particular type of the Bheda or the particular type of Vyadhi that it has actually created. And Bheda Vyakta is when you can only manage the condition and not be actually able to cure it. So usually, clinically that I've seen, patients come either at the stage of Prakopa if they have the leaning towards Ayurveda. If not, they come at the stage of Prasara or Sthana Samsaya. In the case of Prasara, a lot of patients misinterpret any symptoms related to the heart disease itself, so we'll have to educate them. Coming to the important point of differential diagnosis, see, Vyadhi Samprapti is where you can understand whether the problem is actually Hridroga or something mimicking Hridroga, or if it has no bearing with the Hridaya at all. Why do I say this? Because, see, in Gulma, especially Vataja Gulma, Hridkula is a common occurrence. Even in cases of Amaseda Vata, you have a lot of flicking pain in the upper epigastric area, just above the stomach, and it mimics very well chest pain and angina or angina. See, Hridruja is also seen in Amasyasvatavata, and Hrid Upadeha is mentioned in Prameha. A lot of these examples I've mentioned in my book, so you can go through that. Even in Prameha, Hrit Upadeha will occur. So if you just treat Hrit Upadeha as a Hridroga, then you will not be actually treating it itself, because you will not be treating the Akta Samprapti or the Vyati. To further understand this, we will go into how can we know whether or not to actually assess, and how do we diagnose if this is Hridya related or not. The first thing that I clinically use is Astasthana Pariksha. My go-to tool is Nadi Pariksha, along with the Prashna Pariksha and the rest of it. So when I say Nadi Pariksha, of course, in the tradition that I have learned from my seniors, my gurus at Sriranga Ayurveda, so first and foremost, when we look at the Nadi, when we feel the Nadi, we look for Avarana, we see the amount of kleda, we judge the amount or assess the amount of kleda that is present. Then we look into the three sthanas of Vata, Pitta, Kapha, and we see, especially in the Vata sthana, if there is any vilomatva of any of the Vatas. So when we say Vilomatva, it can be Apana, it can be Udana, it can be both of them, it can be Vilomatva of Apana Vata just towards the Samana, or Vilomatva of the Apana Vata right up to Udana Vata. So this will help us in pinpointing whether the problem is of cardiac origin itself, or whether the problem has a different origin. So in some of the cases I've seen in lots of Artha cases, you see that the Apanavikriti is persistent, and if that is very chronic, then it will lead to cardiac ailments. And this is not just in Ayurveda. We've said this thousands of years ago. Even the contemporary medicine has this knowledge that excessive straining during the due to hemorrhoids, causes a strain on heart. So this again, Nadi will help you rule out any causes or the actual origin. Then comes the Mala Pariksha. So when I say Mala Pariksha, it isn't specifically the Samhita based Mala Pariksha where you actually see the quality of Mala, whether it sinks in water, whether it flows. Mala Pariksha also, this you can ask the patient through Prashna Pariksha, you can educate them. The other Mala Pariksha that I ask through Prashna is the number of times that one goes to the toilet, how frequently do they use it, do they always have the urge. Many people, they when you ask some patients if they have a proper routine, if they have the toilet, a proper routine of their toilet habits, so they'll say, yes doctor, I have it once a day, twice a day, it is good. So if next you have to ask them whether or not they take anything to help with it, because a lot of people then fumble up and they'll say, ah, yes, okay, I go to the toilet only after taking some coffee, tea, or maybe a glass of hot water, or maybe a half an hour after having something, or soon after food. This is also very important when it comes to assessment. So you have to ask them very specific questions, not leading, but very specific questions whether they have proper visarjana or not. Next comes again with the Mutra Pravritti also. You ask them whether they get up at night, and if so, what time do they get up? How many times do they get up at night? Because this also gives a very clear picture of the kleba, the consistency, the amount of kleba, and if the samprapti is moving away from the heart or towards the basti, and so on. So this is also again important. Then comes the Jihva Pariksha. I couldn't, unfortunately, I couldn't share the photos, but in a lot of Jihva Pariksha, it is not just the color that matters, it is also the small cracks that you see. Any central crack, especially in the front of the tongue, it denotes Vata in the upper kostha. Again, the same crack in the behind, in the inside of your tongue, that shows Vata in the lower kostha. If it is completely long from the back towards the tip of the tongue, it means that the vata, the Prosthagata vata is very balistic. Then the color and the patchy lepa Again, lip pitta is indicating of any digestive issues, Agni Vikriti. Then it is also indicative of whether it is fatty or not. It is indicative of the lipid profile that you can mind. Then comes the color. If it is very blackish, if it is rosy pink, if it is very pale, and so on. When it comes to Sabha Pariksha, because Hridraga is a Rasa Vikriti Janya Vyadhi, Sabha Sahishtaka is very common in patients. So Sabha, and when you start treating them, automatically it reduces Sabha Sahishtaka. So it is one thing that you can see to check the improvement. Next is Sparsha Pariksha. Sparsha Pariksha, I use it to assess the Kleda. I also use it to assess the dosas which are present. So if the person has a pitta dominant, Pittanubandha pitta dominant dosa, then the Sparsha tends to be slightly extra. Then comes the Drik. Drik here, I take it as Aptikuta Sotha also. When the Drik Pariksha is included, Aptikuta Sotha is included. Then the color of the cornea and sclera, obviously. Then when it comes to Akriti, I take this as the assessment or examination of the body in general, especially check for any swelling, edema, Sotha. Sotha, again, Rasa Vikriti, excess of Kapha, Vata, Rasa, all of this you'll have to check. Next important point would be Prashna Pariksha. Even though this is what we've been doing, asking and talking to your patients is very important when it comes to ruling out different diseases, especially if it is related to the heart or not. Talk to the patient about their vitritis, sometimes the older folks, they do not open up, but you have to try. Because more often than not, it may be something that they're exposed to at their workplace, at their houses, but we will not be finding. I recently had a case where the patient was working in a chemical factory, and for months, for almost 3 to 4 months, we had to give some pitta dravya, and I was starting to doubt myself, where is all this pitta coming from? I put the person of pitta kasaya, I put them on all pitta dravya, but then again, I failed to find the pitta source. Then at the end of 3 to 4 months, I sat down and I spoke to the patient about their workplace also, where then I came to know they work with some chemicals which are very corrosive. Even though the patient said they were in an environment which was very far away from it, he had the chance of exposure in very, very minute doses. So, more or less like Garavista. Once we made the decision of, okay, this is where the problem is arising, and if Nidana Parivartana has to be done to actually get out of this never ending cycle of pitta, then yes, we got the result within a week of changing that shift. The patient noticed drastic changes. So this is why Krishna Pariksha is very important. The next concept that I have seen, I've been practicing, is that when patient comes to us with any tool or any diagnosis which has all these reports, generally the ECG reports, the echo reports, or the angio reports, the first thing that patients ask is, see, this is my case, so what can you do in Ayurveda? Do you know that dosas can be assessed just by looking at an ECG? I'm not making this up, but I have seen in my clinical practice that one can assess the dosas which are present, the sthana of dosa, mainly ECG will denote the vikriti or the extent of vikriti of vata, mainly vata and the involvement of pitta and kapha. So it can easily be done. Even the echo reports, the values in echo reports, just ESV, end-systolic volume and diastolic volume, the regurgitation, all of this will give you a very clear indication of which dosa, where, and what is the actual condition of the avayava or the hridaya. This can easily be done, and all my case reports, my cases have this. Next is our basic sigmoid. When we check the BP, even in BP, we can notice not just the sound, with the sound, next time when you check a patient's blood pressure, notice the rhythm, notice not just where it starts and stops, notice the rhythm, notice the heaviness that is associated with it, notice the sharpness that is associated with it. So this will give a very clear idea of Pitta Vata and if there is any avarana. with a simple blood pressure monitor. That's it. So that can be done. The other reports that we usually come across are triglycerides, the lipid profiles, the liver profile, we get urine routine, we get blood reports and all these. So all of this again, I will not go into much detail, but yes, all of these can be assessed with the Ayurveda dosaris. So if next time a patient sends you a WhatsApp or somebody in your house, they send you a report of what is actually happening, you can sit at home, you can just look at the report and you will be able to see the dosas, which dosa, which avayava, the extent of vikriti, all of this you can see even without talking to the patient. This is what we do at Sri Lanka Ayurveda. This is why I had this interest to pursue cardiology, because this anything that any contemporary field that we use can easily be converted in terminologies of dosa, dhatu, mala, and sleep. So that is the beauty of Ayurveda, basically. So again, when we do not, to repeat this once again, the sthana of dosa, the vikriti of dosa, the extent of vikriti, the guna of whatever dosa that, whatever afflicted can easily be seen using contemporary diagnostic tools. So when I speak of all this, again, I do have to talk about where we as Ayurveda physicians go wrong. Why have I included this? Because more often than not, when patients come to me with a prescription of Arjuna Resha, I feel very bad. Why is that? I know Hridroga, any Ayurveda student you ask them, when somebody says Hridroga, the first thing that comes to mind is Arjuna Resha. Yes, Arjunarisa is a very good, useful medicine, a very good drug. It's a wonder that, but to not use medicine or things like Arjunarisa or Swarina just because they're mentioned in a particular Vyati. Use it only after you come to a proper assessment or you come to a proper diagnosis. See, simply treating, if a patient comes to you with the complaints of blood pressure variations or has a report stating he has coronary artery disease, do not directly jump the gun and prescribe some medicine starters heart related. No, the first step that you've got to do is assess which doses are afflicted, where is the affliction, how chronic is the disease, is there no Agni all of this starts with Agni Vikriti. So I've been holding it until last because everything starts with Agni Vikriti. Your simple coronary artery disease, sorry, your complicated coronary artery disease today started from a simple Agni Vikriti a few years back. So that is why you have to differentiate Hridroga from different Vyadhis that we see. It may be, I said, any Rasavikriti Janya Vyadhis and any Vyadhis to say can cause hridaya-related lessons, ulcers, Ayuryana, Pitta, simple problems of maybe a jvara, where it has not been properly diagnosed or where it has not been properly treated. It can lead to hridaya-related problems. This is where we go wrong. The other thing is do not just read the contemporary reports and go on writing some medicines. No. Like I said, easily with a little practice, you can also see the dosa, dhatu, and mala in ECG, echo, and stigma analysis, and then you can write medicine. Do not skip. Unfortunately, I did have a case where a person was asked to take Arjuna Resha for 3 years, which is not a proper thing to do at all. Because in Ayurveda, we do not believe in giving medicine for an extensive period of time unless it is a Rasayana Dravya. We do not do it. So that patient came with a complication because of excess medicine. This is why I said in the beginning, one of the nidanas is Ati Aushadha Sevana, including ours, not just the contemporary, even ours is improperly given. Next, treat the Lakshana, treat the Vyadhi, and do not just stick to the Lakshana which you see. See if the Lakshana actually has a proper underlying contractile, then go with it. So one of the common things that people do is for every blood pressure case, Ashwagandha is the go-to drug. Do not do it. Assess the proper Lakshana, go through the Samprapti, make the patient understand about Vedana Parivartana, and finally, let me be very clear, Panchakarma can be done in patients who have the lakshanas as given by the acharyas in the Samhitas about who can undergo panchakarma. And if the panchakarma is not properly utilized, then again the ati pravriti, apravriti, and the other lakshanas that we see because of the improper panchakarma will be seen in the patient. So instead of incorrect panchakarma, do not use panchakarma. But if you are going for it, be sure, make sure the patient understands. It is more or less the case is that patient does not understand a lot of things like samsarjana prana or having to be very strict during the Tehapana type. So this is where we can go wrong. Finally, coming to the Chikitsa Siddhanta, the first and foremost thing that I do clinically is Nidana Parivartana. You have to do this. Again, Nidana, all the basic dosa related Nidana and the specific ones that I've mentioned, Atyambupana or the Manovikriti related, all of this has to be stopped. So prevention is always better than cure. That is why we say Swasthasya Swastharakshanam before we say Vipratasya, sorry, the Prasamana. That is why we say the Roga Prasamana comes after Swastharakshanam. The next foremost thing is about Agni and Kleda management. Generally, when we talk about Kleda, it is only at the time of Anna Parinamakala. So Kleda is a concept which I frequently use in my clinical practice. Because Kleda, any increase in the Kleda easily can be seen causing problems of hypertension, causing problems of hypertension, causing issues of Kushta or other respiratory, and it can be dormant for a very long time. Finally, it can lead to atherosclerosis and other issues, which leads to uh, more severe consequences. So, Deepanapasana is why this is why acharyas always begin any Chikitsa Siddhanta with Deepanapasana. Agni is the Mula, Agni is the Brahma, Agni has to be managed properly, and only then can we go for the Sodhana or even Samaya Sadha. Panchakarma, as I've repeated, can be done in most patients unless they are restricted. One fun fact that I'd like to share is even though in Kaphaja Hridroga, initially Kaphaja Hridroga as it is mentioned in as Avamya or in Vamana, Hridroga is one of the lakshanas in which patients should not be undergoing Vamana when it comes to Panchakarma. But if you see the Karaka Samhita reference to Vatija Hridroga and Pittaja and Kaphaja Hridroga, there are Ramaka Dravyas that have been told. Maybe Mridhu or Madhyama Vamana can easily be done, provided the person has undergone proper Dipana, Pachana, and if needed, Samaya. These are all with references that I speak. Next is, of course, the concepts of Abhyanga, Vedana, and Vyayama. So all of you, Dinacharya and Pratisharya, as you can say, but Abhyanga, there are a lot of, massage parlors that must do everywhere that you see. And is that Abhyanga? I say no. Abhyanga has a very proper technique, it has a proper movement, it has a proper timing. And of course, the dravya that has to be used, which again depends on the patient's condition. So Abhyanga as it is, even at home, even as a therapy, it has benefited a lot of patients, especially in hypertension. I used Abhyanga in Dhara, especially with Dhanya Amla, and it has given a lot of good results. Then the one question that everybody asks, do we have to pay medical care throughout life for Hridaya and Hridroga related to it? I say no. When it comes to Ayurveda, if the Samprapti Vighatana is properly done, if the Nidana Parivartana is properly done, medicines are not required lifelong. This is what I say, and a lot of my patients will actually agree to these facts. And finally, yes, one thing that we Ayurveda doctors are make fun of or very lightly said is about Pacha Pacha. When I say Pacha, it is also Hridya. It is once you actually complete the treatment, it is very important to put the patient on Hridya, Balya, and Rasayana Dravya. Those are itself Pacha. And the other opposite of these will be Apacha. Again, when generally speaking, Pacha refers to anything that keeps us very healthy. So my general instructions would remain avoid Atambupana, drink water only when you're thirsty, eat when you're hungry, Anything that you eat or anything that you put into your mouth, I consider that as a meal. It may be an almond, it may be two cashews. No, do not eat in between meals, either 2 meals or 3 meals a day, whichever works for you. Vyayama and empty stomach, no to Vyayama. Uh, Good nidra, avoid phones just before bed. These are some of the basic ideologies. Eat when hungry, do not eat according to time. Have your dinner within 8 o'clock. That is one of the best things that you can offer to your body, which again helps you sleep. So this is the basic Patha Patha. And again, Hridya too. So wrapping up, before I wrap up this discussion, there are only 2 points that I would like to take. So when I say I use a lot of medicines in my practice, generally people tend to think it is very specific or maybe, Hridyarana Varasa, Prabhataravati or Arjuna Rasa. I have used Amrita Rasa in many, many cases. It works. It works wonders. When you write Amrita Rasa, the person, in a way, they just Google and they say, doctor, ಇದು ನೀವು ಜ್ವರಕ್ಕೆ ಕೊಟ್ಟಿದ್ದಲ್ವಾ? Isn't this for fever? I say, no, I've written this because this is what the dosas in your body right now need. Amrita Rasa I've used Hinimbadi Kadha, I've used Nutyadi Kasaya, Taidaryadi Kasaya, I've used Arogya Vardhini, I've used even simple things like antacids that are Ayurvedic antacids, like maybe, Pravala Panchakarta, use Samadhya Rasa, Sutasekta Rasa, I've used Lakshmi Vilasa. All of these, if your medicine tend to the dosas with a Vikrita, then that itself is the medicine for the Hridya related ailment if the patient has come to you. There is nothing, there are specific yogas that are mentioned, but at hand, generally in the last 7 years of my practice, 70, more than 80% of my cases that come with the reports of cardiac ailments have not been actually reported. Most of the cases fall under the category Swara, Kulma, Raktapitta, Prandu, Ayuryana, most of the Vata Vyadhi, and so Arthas, and so on. So this is why this is a general list of subjects that can be used in many, many things. Even Sikshata Kasaya, I've used a lot of these. I've used medicines meant for the liver. I've used medicines which are particularly meant for the breast tube. Maybe Brihatvarinadi Kadha. I've used different conditions which come up with cases that seem cardiac or cardiovascular disease. And finally, wrapping this entire thing would be with the interesting case, which is usually when I say, okay, the case that I've seen, though it had cardiovascular ailments in the report, I said this is not so. So people ask me, how can you be sure? It is a samprapti of many, many cases. As you can see, I have seen cases which said it was the hypertensive case, they said they came with rheumatic heart disease, the reports. But when through Sthana Pariksha and Prashna Pariksha, it came with that it was simple jvara. One case of hypertension was of a 50 plus year old gentleman where he had a bout of dengue and a bout of chikungunya 1 year apart. And post that, he said his BP would fall very low, usually 70 over 50, 90 over 50. This was his case, but he had no other lakshanas. So he was terrified of it. So when we went back, we saw it was Jvara. So in this case, I had simply used Mahasudarsana Kadha and probably Ajamodadi Chuna and Mukkadi Gulika. Jvara Chikitsa. So Kapha Pittahara, Jvara Chikitsa, we got done and the blood pressure came out to be normal. The next case that I would like to detail about is the dilated cardiomyopathy. This patient, this was a female patient around nearing her 50 years. So she came to us with the complaints of her EF, the ejection fraction in the echocardiography was well below 20%. The first time she came to us, it was 15%. The next time she came within some time, it was 25 or 28%. So it was drastically very less. So in this case, when we went out to actually see what was happening, it was simply a case of Udavarta. She was in her menopausal age. She was suffering from Udavarta for quite some time, and it had led to dilated cardiomyopathy. In this case, I remember using Shivakulita, Kankayanavati, and Viswansi to actually treat it, and now she leads a very happy life. The patient can do everything on her own, and it is not a more much medicine also. So this is why you have to see. You will see it is terrifying when a person comes to you with that low of an infection fraction, that severity of a complication. So sometimes you become fearful of, oh, can I do this or not? Simply go with finding the data, finding the dhatu, finding the avayava and just order. Next is cardiomegaly, where we had balloon road. It becomes very big. So that was a case of arthritis. So that was again, we treated the arthritis, and just after some time, after 3 months, we got an echocardiography done. So it is somewhat with normalcy because we treated arthritis. So just with Artha Chikitsa, we did some Hridya along with that simply, and it came down. Again, different cardiomyopathies also we see with upset. Next is the case of very simple case of hyperlipidemia. So the patient around 45, 46, male, he came with a complaint of increased triglycerides. So that was simply a case of Kushta when we took the history. So the patient said, okay, how is that related to my skin disease? So we had to explain it to him, we declare the Agni and all that. So then we treated the Kushta, and automatically his lipid profile came into normalcy. Next is the case of this in most of the Samopitta conditions or Vidagdha Ayuryana conditions, there is always an increase of triglycerides and the total cholesterol. So again, for physicians who work on this, in any case of increased triglycerides, Samopitta is always there. Please check it. Please attend to it. Next is the case of hypertension, which was actually a case of Pitta. This was in a young girl of 20 years. It was Pitta Pandu, but she had this hypertensive issue, which was very easily resolved. Again, the other thing about ischemic heart disease, where we had a patient who had the textbook definition of Vata Lakshanas. The one thing with Vata I remember about this patient is that the fickle-mindedness is a part of disease itself, and we did see that in the patient also. And finally, yes, coronary artery disease, we've seen many cases of Vata, most cases of Udana Vikriti in teachers and professors and marketing people who talk a lot, including as doctors. A lot of them end up with Udana Vikriti, which in time becomes a coronary issue. So Tamuka Swasa, we've seen a case and we've treated it. Most of the valvular regurgitations that we see is again Udana Prana and Prana Vikriti Janya. So this was about how Hridroga are not the same as heart and the cardiovascular diseases that we see. Ayurveda has a lot of things to share about Hridroga. The management of Hridroga, it has a lot of medicines, it has a lot of patchas. So I think I learn every day. In the last 7 years, I say that I learn every day. We see different cases. So with this, I'd like to wrap up my presentation for today. I hope this helps you. I hope that I hope the students who are watching this come up with their own terminologies. I hope that you come ahead and join us in re-establishing the actual theory of Ayurveda as it was before. Thank you. I'd like to thank Ayuryana, the team of Ayuryana, for giving me this opportunity to present my knowledge, my limited knowledge about cardiology here on this platform. So thank you. And also at the end, I'd like to mention my gurus of Sri Ranga Ayurveda Chikitsa Mandira, Dr. Prasanna Venkatesh and Dr. Dayananda, along with the blessings of Dr. Niranjan and Dr. Patanjali. Thank you. And all the gurus that I've had, thank you.
Thank you very much, ma'am. Ma'am, there are few questions in the chat box. Are they visible? Ma'am, can we take the questions in the chat box?
Ma'am, there are few questions in the chat box. Is it visible?
Well,
Ma'am,
okay, okay,
ma'am, there are few questions in the chat box.
okay. Can we manage emergency situations till we reach hospital? Yes. Can I answer this? Shall I go
Yeah.
ahead? Yeah. So yes, definitely depends on the kind of emergency that you're referring to. So in many cases, usually when we say emergency, it is either angina or severe chest pain or very high blood pressure. Yes, it can be managed if you have the proper drug testing. See, at Sriranga Ayurveda Chikitsa Mandira, as we are a hospital, we have a lot of drugs at hand. Say totally kalpanas we have even a simple knack is to have Godanti Bhasma at home. Um, One thing that I've learned from Dr. Patanjali and Dr. Prasanna and Dr. Dayanand is that Godanti Bhasma has a lot of benefits when it comes to Pitta Vata, especially in emergency management. So yes, it can be managed, but you should actually be able to read the nadi. You should have the drug at uh, some medicines that I can say would be the Sumunarista, Godanti Bhasma, Swarna Kalpana. It can be a simple Bhrata Kalpana or a Swarna containment. Um, these can Vayu Gulukta or Brihatswata Sultamani. These medicines, if you have at hand, yes, simple emergencies can be managed. So, okay, the next question is from Ishwari. It is asked how to distinguish among heart patients that we can treat them or not. Again, as I said, madam, just look at take care of first sthana pariksha. That will give you a very pointed result whether it is of the cardiac tourism, whether Udana Vikriti is dominant, whether Apana Vikriti is dominant. Whichever patient, whenever the patient comes with a proper report from the contemporary sciences, convert it into dosa dhatu mala and then see them. Do not see the report and treat them. Look at the patient, look at the lakshanas, look at the asthana pariksha, and then decide to treat them. If you can treat hridroga, to what extent? Okay. The extent with which we can treat depends on the Kriya Kala that the patient has come to us with. If the person comes at Prakopa, Prasara, Thanasampraya state, it is very easy to reverse it. I'm saying based on the assessment, based on Dosa Dhatu and Mala, not on the basis of a report. Hridroga, if you've looked at it in terms of Ayurveda, if it is in the proper Kriya Kala, it can be managed, it can be reversed. But if it has gone to Vyakta or Veda stage, it can only be managed easily. It can be managed easily. A reversal may take a very long time, but yes, it can be managed. So next question is, which kind of vyayama do I advise? Which is, okay, everybody goes to the gym nowadays, yes. So when it comes to Vyayama, I say, which as mentioned by the Acharya, what basic stretching exercises, basic yogasana, yes, it can be done. When again, Vyayama also includes patients clubbed with pranayama. So pranayama, in case of Sudhana Vikriti, I mentioned the patients to not do Bhastrika pranayama, not do Kapala Bhati, etc. Wherever which increases the Vilomatra of Jata. So those have to be avoided. Dhyana can be done for people who chant her, if they're Veda parties or if they sing bhajans or if they're singers or they're teachers, then that is also a sort of exercise to the vocals. So that has to be reduced. Daihika Vyayama, it should be within the range that the Acharya suggests. You shouldn't be feeling out of breath. You shouldn't be feeling completely exhausted after you do Vyayama. Again, specifically, it depends on patient to patient. So, gym, yes, if the person is of good prakriti, if they have proper bala, then yes, they can go to the gym, but given the timing must be very good. He or she should have good bowel movement. His bowel should be evacuated. He should not be extremely hungry. He should not have had food just maybe an hour or so before he or she goes to the gym. Then it is fine, not more than that, and not more than 25 to 30, maximum I would say 40 minutes at the time. So the last question is, what are the things to prevent heartbreak? See, the first thing is to not be scared of it. So yes, left, right, and center, you have people talking about how they have hypertension, how they have cardiac issues, but do not be scared of it. It is just another avayava in your body. Make sure you assess it first. Do not be, see, when I say stress free, a lot of people will ask me, how do I do that? Yes, see, there is students, they have stress, clinicians, they have stress, working people, they have stress, even the grandparents have stress nowadays. So, anyway, try and be capable of in managing your day-to-day activities. Prevention, again, it also includes following a proper dinacharya, following proper ritacharya, ahara krama. Ahara krama, day-to-day, whatever, as Acharya Saraka has mentioned, or as he has emphasized, proper ahara karma, ahara parinama kala is another topic that we can discuss, but ahara in uptake that should be proper along with mono vikriti staying away from those. These are basically the things that you can do to prevent hridroga, just like any other disease. Patha, following patha. That's the how you prevent hridroga. So those are all the questions.
Yes, ma'am.
Uh,
Thank you very
okay,
much, ma'am, for your insightful and
thank you,
enriching session.
thank
Your
you, Anna.
expertise in Ayurveda. Yes, ma'am. Questions are finished. Thank you very much, ma'am. Your expertise in Ayurveda cardiology has truly enlightened us all. We are all grateful for your time and valuable contributions today. On behalf of Team Ayuryana, I extend a heartfelt gratitude to our esteemed speaker. Thank you, ma'am. A huge thank to our entire Ayuryana team for organizing this incredible webinar. Your collective efforts have made a significant impact. I request everyone to like, share, comment, and subscribe to our Ayuryana YouTube channel. Dhanyavad to each and every one of you. Thank you so much, ma'am.